Welcome everyone, and thank you for joining today's webinar on health effects associated with harmful algal blooms and algal toxins. This webinar is part of EPA's Office of Research and Development's Water Research webinar series. We have a great presentation today, and before we get started, I'd just like to go over a few items to note. First is that there's a PDF copy of the webinar slides located in the handouts in the right-hand navigation bar. We'll be saving about 10 minutes at the end for a Q&A session. There's a questions box in your navigation panel, so please type your questions in throughout the webinar at any time, and we'll try to get to as many as we can at the end. If you're experiencing any audio issues or technological issues during the webinar, feel free to drop us a chat in the chat box, or go ahead and email the webcast info email on your screen. This webinar will be recorded and will be posted, and it'll be on our Water Research Webinar Series webpage within 1 to 2 weeks after the webinar. Finally, we do offer certificates for this webinar. We do have a few requirements for that. First is that we require that you're either registered for the webinar or in a room with someone who's registered for the webinar. You must be in the live webinar for 60 minutes. And finally, this is a little bit new for this webinar, but we have a form for you to fill out if you are in the room with someone who's registered for the webinar. So we ask that you submit the names through that form, and that form is linked in the PDF handout. It's also in the chat box in the GoToWebinar panel. And I'd also just like to share a few webinars that we have coming up of interest. The Small Drinking Water Systems webinar. The next one is November 17th, the AWEA in Creating Resilient Water Utilities. We have a Tools and Resources webinar, Drinking Water and Models and Tools, on November 18th. And then finally, the next water research webinar is November 18th, and that's on property values and water quality, supporting decisions with a hedonic model. And with that, I'm really excited to introduce our speaker today. Dr. Elizabeth Hilborn has worked as an environmental health scientist and epidemiologist with EPA's Office of Research and Development for over 20 years. She has a BS in biology and a sorry, just lost my screen for a second there. Masters of Public Health, and that's from the UNC Chapel Hill, and she also has a doctorate in veterinary medicine from North Carolina State University. So with that, I will pass the slides over and the microphone over to Elizabeth, who will take the presentation from here.
Well, my first slide is about cyanobacteria, because I think harmful algal blooms in general, we have a problem with nomenclature. People use all different names for green blooms in fresh water. So you might hear blue-green algae, harmful algal blooms, toxic algae. These can all be referencing a very specific group of organisms, cyanobacteria. If you look on the right, there is a box that shows 3 domains of life. The red are the eukaryotic organisms. The green and blue are the prokaryotic organisms, the green being the archaeans and the blue, the bacteria. Next slide. But cyanobacteria are not algae, even though we refer to them as harmful algae. Algae are eukaryotic organisms. Next slide. Whereas bacteria are photosynthesizing bacteria. Cyanobacteria are photosynthesizing bacteria. And next slide. They're globally abundant. They are all over the earth, from the Arctic to the Antarctic. They're in terrestrial and aquatic ecosystems. And we care about them in aquatic ecosystems because they can form dense assemblages of cells and cyanobacteria that we call blooms. And these blooms are favored by warm, stable, nutrient-rich waters. And sometimes cyanobacteria can produce potent toxins. And this is a problem and may increasingly become so with global warming. One of the most common groups of toxins, microcystins, are actually have higher production at higher water temperatures. Nutrients are important because many of these cyanobacteria are nutrient limited, so nutrient control is key to reducing bloom occurrence. Next slide, please. I'm including this very old slide just for kind of a rough reference. The WHO came out with guideline values for human health and cyanobacteria blooms or congregations. They gave some guidance on what level we should be worried about cyanobacteria density. So we're going to discuss cyanobacteria cells per milliliter of water. WHO guidelines indicate over 20,000 cells per mil, there's a risk for mild health effects. Gastrointestinal illness, which is nausea, vomiting, diarrhea, dermal illness, skin irritation. At over 100,000 cells per mil, there's a potential for more severe illness, including such things as organ damage. Now, scum formation is a special problem for health because when there's a bloom of cyanobacteria, wind can blow surface accumulations to shore and you get vertical accumulation of cyanobacteria. So these are very thick scums. And if you're dealing with a toxic bloom, there can be very high concentrations of cyanobacteria toxins in that scum. So this is a potential situation for acute poisoning. Now, these guidelines were developed back in 1999, and they don't fit our current observations super well. So they have not been updated to the best of my knowledge. Next slide, please. I've been mentioning toxins, and I want to make it clear that cyanobacteria are really bioactive compound factories. They produce a wide range of bioactive compounds, not just toxins. Some of them are beneficial compounds like antioxidants, but cyanobacteria are an active source of bioactive compounds for drug discovery. There is a lot of research in this area. But I've listed 4 of the most commonly well-characterized and commonly discussed compounds. These are found in fresh waters in the United States, among others. So the first is anatoxin A. It's a neurotoxin, and it mimics the effect of acetylcholine. It can result in diarrhea, vomiting, at higher doses, convulsions, and death. It used to be known before it was named by Steele, I believe, as very fast death factor, and it still earns that name. This is a toxin that has been associated with dog deaths, and it works quickly. So people will be out recreating with their dog. The dog gets thirsty, starts drinking contaminated water, and the dog may be dead within an hour or 2 after exposure. Cylindrospermopsins are general cytotoxins. They affect multiple tissues, they inhibit protein synthesis, and they're actually, for a given dose, you'll see more severe effects over time because as the cylindrospermopsins are metabolized, they produce toxic metabolites. Microcystins are liver toxins. They're very potent protein phosphatase inhibitors. And They were designated by the International Agency for Research on Cancer, a group within the WHO. Microcystin LR was designated as a possible human carcinogen. Saxitoxins are another group of neurotoxins, and they're sodium channel blockers. You may be familiar with them as agents of paralytic shellfish poisoning. So they also occur in marine harmful algal blooms. Next slide, please. Now, EPA's Office of Water has issued health advisory concentrations for 2 of these groups of toxins, microcystins and cylindrospermopsin. Recreational ambient water swimming advisories for microcystins at 8 micrograms per liter, cylindrospermopsin at 15, and also drinking water health advisories. And you may notice, again, same 2 organisms, but there are 2 levels, one for adults, a higher concentration, and one for preschool children. And this is because young children can have higher exposure to fluids. Very young children might be bottle fed, so drinking water is used to prepare formula. And then slightly older children, drinking water can be used to prepare juice, and kids drink a lot of fluids. So for microcystin for preschool children, we're looking at 0.3 micrograms per liter and cylindrospermopsin 0.7. Next slide, please. Some potential sources of human exposure are probably the best characterized drinking, recreational waters, and drinking water contamination is uncommon. Drinking water is treated, and conventional treatment removes most of the risk associated with cyanobacteria and cyanotoxins. So drinking water associated illness is uncommonly reported. Recreational waters, very different. These are situations where people are exposed to untreated water, to blooms, potentially to the scums we mentioned earlier. I would like to mention a high-risk scenario for drinking water. And this is where, I don't know, I'm familiar with the lake cottages in the north, but it also happens in the west and the mountains where people have these cute vacation homes around a lake, and then there's a pipe that goes into the lake, and people will pump water out of the lake, use it for showering, cooking, and sometimes drinking. If that lake becomes contaminated with cyanobacteria, that is a high-risk drinking water exposure. It's untreated surface water. The second bullet, hemodialysis. This is a medical treatment, and it's given to people with end-stage renal disease. They can't clear the toxins from their blood. So hemodialysis is a treatment where people are exposed to a solution called dialysate, and it's frequently produced from drinking water. It's purified drinking water. Sometimes that purification, rarely that purification process fails and people can be exposed to toxins. Aquatic foods can be a source of exposure. We know that fish and invertebrates, aquatic invertebrates, they're living in potentially contaminated water, have measurable concentrations of toxins in their muscle tissue, but particularly in their guts. So our current understanding is the highest risk exposures are for people who are consuming whole organisms, like a whole bivalve or a soft shell crab, where they're ingesting the gastrointestinal tract, not just the muscle tissue. But this is an area of active investigation, and we don't have guidelines for or fish advisories. We still have a lot more to learn in this area. Ambient water. We know that people are exposed to cyanobacteria and their toxins through aerosols. Cyanobacteria is in the air, wind can blow over blooms and aerosolize cyanobacteria. People create aerosols when they jet ski or water ski. So we know there's exposure. We don't know much, if anything, about potential health risks. Cyanobacteria is used as a food ingredient and also as a supplement by itself. And there's a body of evidence that supplements can become contaminated with cyanobacteria toxins, but most large reputable producers do monitor their supply, but it's something to be aware of. And produce can become contaminated. Irrigation water, if it's contaminated with cyanobacteria, it can contaminate the soil. Produce items can take toxins up into the plant, or if there's overhead irrigation, cyanobacteria can be deposited on the plant. Again, a potential source of exposure, but we don't know anything about potentially associated health effects. Next slide, please. So I'm going to just give a kind of a surface overview of I'll be going back in time because I just want to give you an idea of kind of how long we've been dealing with this issue. But it's just a casual review. I don't have time to go into every report for every category. Next slide, please. So drinking water associated effects have been reported for a long time. This isn't even the oldest, but in 1979, there was an outbreak of illness on Palm Island in tropical northeastern Australia. There was a cyanobacteria bloom in a reservoir, and people complained of taste and odor problems. Copper sulfate was used to disrupt the bloom, and after copper sulfate was applied, over 150 people became ill, and over 100 required hospitalization for severe gastroenteritis and liver damage was confirmed. Most of those people were children. Now, years later, a subsequent investigation implicated an organism called Cylindrospermopsis that in Australia is known to produce cylindrospermopsin, that general cytotoxin I talked about. So it's possible that people were sickened by cylindrospermopsin, but they did not know it at the time, what the cause of this outbreak was. In 1981, there was a retrospective study, and this was interesting. There was a microcystis bloom in a drinking water reservoir. Copper sulfate was used to disrupt the bloom. The researcher went back and pulled information about what liver enzyme reports were coming through from people who were drinking that water, community members. So liver enzymes are biochemical markers of liver injury, and microcystis can produce microcystin, a liver toxin. Ian Falconer was able to show that before the bloom, liver enzymes were at baseline. After the disruption of the bloom with copper sulfate, they spiked. And then again, after the bloom was resolved, the liver enzymes fell again among community members who drank the water. A case control study was conducted by El Saidi. He was evaluating the effect of river water and found higher odds of gastroenteritis and dermatitis or skin problems among people who drank cyanobacteria contaminated water and had body contact with that water. Next slide, please. In China in 1995, Yu summarized multiple studies. He found that there were higher rates of liver cancer, hepatocellular carcinoma, among people who drank surface water from rivers and ponds compared to groundwater consumers. Zhao in 2002 performed a retrospective cohort study and found a higher risk of colorectal cancer among people who drank surface water compared to groundwater consumers. And Lee in 2011 reported a cohort study of children. He evaluated children's liver enzymes, microcystin concentrations, and found microcystin in serum, and found higher concentrations among children who drank surface water versus well water. Next slide, please. In Canada, Levesque performed a prospective study, and this was up in northern Lake Champlain, found that those drinking cyanobacteria contaminated water, this was, I recall it was a small community water system, but during a cyanobacteria contamination event, they reported increased muscle pain, gastrointestinal illness, skin, and ear problems. This is one of my favorite studies from 1930. Tisdale had a study of a cyanobacteria that formed a bloom that formed on the Elk River in West Virginia. And it was a mess. It was a very dense bloom, fish kills, it stank. The bloom flowed downstream out of the Elk where it joined the Kanawha River and then into the Ohio. And he documented a series of gastrointestinal outbreaks of illness among people who received drinking water from the river as the bloom went by. So there was a temporal association. In 1998 to 2008, Bedeau and colleagues looked at elder hospital admissions for gastrointestinal disease in Massachusetts and found that higher rates of admissions were associated with higher turbidity in the water and also low water temperature, cyanobacteria, and fecal coliforms. Next slide, please. So in 2014, Toledo, Ohio suffered a breakthrough of microcystin toxin into finished drinking water. On August 2nd, a do not drink order was issued, and it was very disrupted. People didn't know what to do. We've heard of do not boil water advisories. Well, this was a do not drink advisory. So there was a huge demand for bottled water. And on the right, you can see the water line, one of the water lines in Toledo. Next slide, please. McCarty and colleagues from the health department conducted a community needs assessment to understand, did people hear about the do not drink advisory? How were their lives affected? They surveyed 171 households, and they found that the do not drink order resulted in physical illness, mental illness, and a disruption of activity in a subset of families. And people reported continuing to use the water even though they had heard the do not drink order. And they also, some reported continuing to use bottled water even after order was rescinded. Next slide, please. So I'm going to talk a little bit about microcystin exposure via hemodialysis. Next slide. Oh, I'm sorry, can we stay on that one for a moment, the picture? So hemodialysis, I mentioned, is a treatment for end-stage renal failure, and it's very burdensome. People have to go to dialysis centers and sit there for hours while their blood is pumped out and into this machine where the blood is run past a semi-permeable membrane. On the other side of that membrane is the dialysate, which is a hypotonic solution that where the toxins in the patient's blood, such as urea, that the kidney would normally clear, flow across the osmotic gradient into the dialysate and are cleared. And over time, hours doing this, the patient's toxic burden is reduced in their blood and they're good for another few days till their next session. But The cyanobacteria toxins are pretty small molecules, and unfortunately they can flow the other way from the dialysate back into the patient's blood. Next slide, please. And this is what happened in 1996 in Caruru, Brazil. 131 people were exposed to contaminated water, contaminated dialysate. So the drinking water was typically treated before it was brought to the dialysis center, but there was miscommunication. It was only partially treated, and there was a cyanobacteria bloom at that time in the lake. So there were cyanobacteria toxins in the water. 20 people died of acute liver failure within a month of exposure, and eventually over 50 people died with deaths attributable to liver failure from exposure to the toxins. Microcystins were found in patient serum and in postmortem liver tissues. And there was also a question of potential cylindrospermopsin exposure in the dialysate charcoal filters that they used for preparation of the dialysate. Brazil clamped down hard on dialysate preparation and regulated the use of reverse osmosis for dialysate preparation. Unfortunately, in 2001, there was a failure of reverse osmosis in Rio de Janeiro at a dialysate center, and 44 patients were exposed to contaminated dialysate. 13 ended up with measurable serum microcystin concentrations after exposure. Now, some of the people involved in this incident had been involved in the earlier incident, and they were ready to try to use this tragedy to understand what was happening in those patients' bodies. So they recruited a cohort of patients to follow over the next 2 months. Next slide, please. So a total of 13 people were exposed. This is a graph showing microcystins on the y-axis and the day of the study on the x-axis. And you can see for almost 2 months during the study period, each one of these symbols represents a patient. So you can follow a patient by looking at, say, the blue square over time across the 2 months. And what really stands out is that microcystins were detectable in blood for 2 months. They didn't seem to be dropping off by the end of the study. This happened also in the earlier Caruru event, where people had detectable microcystin in their serum for a prolonged period of time. Next slide, please. Now, luckily, this event was a low dose event. It was a sublethal event, but people did have health consequences. There were elevated liver enzymes and altered clotting function, showing a mild to moderate mixed liver injury after exposure to the microcystins. So there were some limitations. It was a small number of patients with evidence of exposure, and not every patient came back to have questions answered and their blood drawn every week. So there was some spotty data. However, it was a valuable study in that it really suggested some future evaluation if there's ever a way to prospectively follow microcystin exposure again. So looking at some liver function, some biochemical outcomes of interest would be products of lipogenesis like cholesterol, triglycerides, clotting factor production, plasma protein concentrations, and also bile acid concentrations. These may be involved with the maintenance of microcystin concentrations in the body over time. Next slide, please. So now I'll talk about recreational exposure, and there are definitely more reports of these type of events because people are exposed to raw water that may be contaminated. Next slide. I want to make the point here that when people are recreating in a cyanobacteria bloom, they're not just being exposed to cyanobacteria. It's not a monoculture, it's an aquatic community. So they're exposed to mixtures of phytoplankton, including cyanobacteria, mixtures of cyanobacteria toxins, mixtures of microorganisms, including other bacteria, viruses, protozoa that may live in the community. Next slide, please. So back in 1989, there was an outbreak among young soldiers who were canoe training on a lake in the UK. They were learning how to capsize a canoe, get back in the water. They were immersed in the bloom. Many became ill with acute gastroenteritis, but 2 were hospitalized and they had elevated liver enzymes and apparent aspiration pneumonia. Now I say apparent because microcystins are liver toxins. Why did these young men develop pneumonia? So it was assumed that they had inhaled water while they were in it, maybe gasped as they were being immersed in the cold water. But that thinking changed in 2007. Giannuzzi reported a young man who was exposed in a heavy microcystis bloom. To the best of my knowledge, he did not inhale bloom material. He rapidly developed gastroenteritis and respiratory illness and had to be hospitalized. He had to be intubated. He developed respiratory distress syndrome and elevated liver enzymes. Next slide, please. In Finland in the early 2000s, Rapala and colleagues were evaluating lake water for saxitoxin concentrations. They were monitoring lakes over 2 summers, and they were contaminated with Anabina blooms. Well, near the end of the study period, 3 children who'd been recreating in one of the lakes reported health effects: fever, eye irritation, rash, and abdominal pain. Now, we don't know the children's exposure, just they were in one of the monitored lakes where there had been low concentrations of saxitoxins. Next slide. In Australia, in 97, Pilato reported the results of his prospective study, where he evaluated people after they recreated in water, and he assessed the water quality while they were recreating. Within a week, many people had developed gastroenteritis, eye and mouth irritation, and he found an association with cyanobacteria cells at greater than 5,000 cells per mil. And remember the low health effect category that the WHO had, the guidelines back from 99 suggested that about 20,000 cells per mil was a concentration of concern. So this was much lower, and it was really an outlier. Nobody else had done this kind of work. Osborne did evaluation of a marine cyanobacterium. It used to be called Lyngbia majuscula, and it creates dermal illness, itching, ulceration in high doses. It can be miserable. He surveyed people who'd been swimming in the contaminated water and found that about 35% reported some sort of health effect and 23% reported itching, problems with their skin, and he reported a dose response relationship between the Lyngbia and people's effects. Next slide, please. In the United States, there are some seminal reports of allergic effects associated with blooms. So Heiss had multiple case reports from the 30s and 1940s where people reported respiratory irritation all the way up to asthma attacks. And he studied these people. He determined the association with the blue-green algae and the recreational water they were using. And among a couple of patients at least, he collected some of the bloom material and tried to desensitize patients using intradermal injections of bloom material. He was successful with one patient. He desensitized him and he was able to enjoy swimming in contaminated waters afterward. So in 1952, Cohen and Reif describe a case where a young girl had been having repeated rashes after swimming in the lake at their summer home. And the mother brought the girl in. The physician had gathered bloom material from the lake, and in order to test if it was the bloom material, he applied it to her back and was able to elicit a rash. Next slide, please. In 2011, Trevino Garrison and her team evaluated a very active harmful algal bloom year in Kansas. There were cyanobacteria blooms in multiple lakes. Probably the focus of inquiry was Milford Lake, one of the largest lakes in Kansas and a big recreational lake. There were 13 cases of harmful algal bloom associated human illness, and 7 of these were confirmed. Now, what that means is whoever was giving their health care, a physician, nurse practitioner, determined that their effects were associated with their harmful algal bloom exposure. There are no diagnostic tests, so this is a judgment call. It's a diagnosis of exclusion, meaning where everything else has been ruled out, yeah, it's probably that. People experienced a bunch of different effects: rash, gastrointestinal, eye, respiratory effects, fever, joint pain, and a gentleman was hospitalized with pneumonia. These blooms were also associated with dog deaths and a dog illness, and again, a variety of effects up to seizures. So dogs drink the water. People just recreate and try not to drink the water typically. So dogs typically are expected to have higher exposure to cyanobacteria and toxins. Next slide, please. So the Centers for Disease Control and Prevention runs a national outbreaks reporting system. It's a surveillance system, and it is used for multiple modules of surveillance. They do foodborne illness, community outbreaks or person-to-person illness, waterborne illness, drinking water, recreational water. It works in the way that states will detect the outbreak, investigate the outbreak, and then submit the information to CDC. For waterborne disease outbreaks, CDC compiles the information, summarizes it, and reports out every couple of years. For the 2009 to 2010 reporting cycle for recreational water associated disease outbreaks, there were 11 algal bloom associated outbreaks. There had never been so many. These are from 3 states, New York, Ohio, and Washington, and all the outbreaks occurred at lakes. Among all of them, 61 people became ill, but there were no deaths. The majority of people affected were females, less than 20 years in age, and the majority sought health care of some sort. So they visited their doctor, or they visited their doctor and went to the emergency room. It could have been more than one category. Next slide, please. And there were multiple health effects reported after these exposures. Dermal and gastrointestinal effects were the most common, respiratory effects, coughing, asthma attacks, pneumonia, and non-specific effects like fever, headache, loss of appetite, and then ear problems, neurologic effects, and other effects like muscle and bone pain. Here's a clue about cyanobacteria-associated illness, and this was present in some early reports of bloom-associated illness. the median onset of illness was less than a day. And that's unusual. And for infectious exposures, it's uncommon. There's not much that will produce illness within a day for waterborne disease. Some of the outbreaks evaluated toxins, 8 of the 11. The most commonly detected were microcystins, as well as anatoxin A, saxitoxins, and cylindrospermopsin. Next slide, please. Cyanotoxins were found in mixtures, and microcystins were the most commonly reported because there was a commonly used tool at that time, and also they might have been present more often. It is a very commonly detected group of contaminants. But I'm showing you this slide to show you that there were mixtures of toxins, and they varied in concentrations. Outbreak number 4 in the first column and number 8, severe illness was associated with both of these outbreaks, and yet you can see very different toxin concentrations. Now, these were the maximum value for toxin concentrations during the outbreak period, plus or minus a day. So they're temporally the best match we have for these outbreaks. But you can see there's a big disconnect in toxins and effects. Next slide, please. I just want to mention One Health, because remember the Kansas outbreaks, there were dog deaths as well as human illness. Well, One Health is a great paradigm to apply to cyanobacteria because we're impacting the environment's impacting us, impacting animals, and animals can actually warn us, like the Kanawha River, there was a fish kill, warn us of a problem in the water. Next slide, please. And actually in the outbreak report I was just discussing, this is outbreak number 6 and 8. And there was, in outbreak 6, there was a fish kill and dog deaths that preceded the human illnesses. In 8, a heron illness and dog deaths. Next slide, please. So in response to this very active outbreak year associated with HABs, Virginia Roberts at CDC started a new module in the National Outbreak Reporting System to only focus on harmful algal blooms, both freshwater and marine, not limited to cyanobacteria, but including human health events, animal health events, and the blooms themselves. And they're just about to report out on the first couple of years. The system started mid-year 2016, so this will be just over 2 years of surveillance, but that's in press, so look for that soon. Next slide, please. And I wondered, because of those preceding animal deaths before the human outbreaks, I wondered how common is that? Is that something that can be helpful to warn of human health risks? I'm showing this graphic because this is a multidisciplinary event, and someone who's studying water may not necessarily think about human health. The physician may not necessarily think about water. So it's really important to control the risk of these events by speaking to professionals across different professions. Next slide, please. Now, we found that sometimes sentinel events of animal illnesses and deaths could inform and modify human risks, such as there were lake closures in response to animal illnesses and deaths. There were warnings to people not to go in the water. And the most commonly useful groups of animals were livestock and dogs. I'll call out specifically because these are owned animals. People are keeping an eye on them. They notice when they're ill. Other wildlife, not so much. People may not notice a bird or a bat beside the water dead and associate it with the water. But fish really capture people's attention. You can have many fish dead during fish kills, people are out on the water, they notice the fish. So these are all groups of animals that can be helpful to inform human health risk associated with blooms. Next slide, please. We conducted a prospective study of marine waters and people recreating in these warm tropical waters in southwestern Puerto Rico and Boquerón Bay. Just over 15,000 people were recruited over 26 study days. And if people agreed to participate, they gave baseline information about demographics of their household, about their health status, did they have chronic disease of any kind. After they spent the day at the beach or hours at the beach, they checked back in at the end of their time on the beach and told people what they did. If they went swimming, how long they were in the water, did they swallow water, was their head underwater, did they just sit on the sand the whole time? Then 10 to 12 days later, they were contacted at their homes and asked to report any health effects that might have developed. Next slide, please. Now, the water quality in this bay was really good. So we evaluated all marine phytoplankton because in marine systems, certainly diatoms and dinoflagellates can also be associated with human illness. But concentrations were low of all the three phytoplankton categories we evaluated. And I'd like you to notice the cyanobacteria. The maximum concentration was under 1,500 cells per mil, so a low concentration. Because these were marine waters, we evaluated two toxins that are associated with the marine cyanobacterium, formerly known as Lyngbia majuscula, now Morea prudescens. We evaluated Lyngbia toxin A and Dibromo-Aplysia toxin, and both of those were at non-detect levels, could not detect those. The water quality was good for fecal indicators, all samples less than 35 colony forming units per 100 mils. Next slide. So we evaluated exposure to cyanobacteria in quartiles. We used the first quartile as the referent, the middle two as the first moderate dose, and then the highest quartile is the highest dose. We found no increased odds of gastrointestinal illness, but we did with respiratory illness at both the middle and higher dose. Eye irritation approached significance at the highest concentration of exposure, but did not quite make it. Rash, the highest concentration of exposure, was significantly associated. And this is all just cyanobacteria concentrations. Now, earache did not reach statistical significance. And I forgot to mention at the top in the title, this is 12,000 people. These are the people who went into the water, who immersed their body in the water. With earache, if we restricted the analysis to people who swallowed water, then earache was significantly associated with exposure to cyanobacteria. Next slide, please. And this is a estuarine recreational exposure. It was reported in 2017 from an Argentinian group, and they document an Argentinian family was recreating on beaches in southern Uruguay, and this is just across the Rio La Plata estuary from Argentina. And the Rio La Plata blooms. Nutrient-rich rivers flow into the La Plata, and there were blooms on the beach, there were blooms in the La Plata, and everybody became ill after they recreated. The adults recovered, but the 20-month-old child in their group did not. She experienced liver failure, and back in Argentina, she received a liver transplant, and in the explanted liver, they found microcystins. Next slide. So in summary, animal illnesses and deaths can inform human health risk. These animals are being exposed to much higher concentrations and can hopefully precede human health human exposures to prevent health effects if action is taken. Recreational exposures can be a high-risk exposure to cyanobacteria. Multiple routes of exposure. People can drink the water. Their skin is in contact with the cyanobacteria. They can be exposed to mixtures of phytoplankton, toxins, potentially pathogens. Multiple non-specific health effects have been reported, and these are poorly characterized. The health effects in themselves don't really point to cyanobacteria. And typically, if people are visiting the physician with nausea or vomiting, they're not going to be thinking to pull liver enzymes to evaluate their liver status. There's a lack of awareness. So the patient may not report that they were recreating and then became ill. And the physician, if seeing respiratory disease and a rash, won't necessarily think of cyanobacteria. One diagnostic clue is that onset of illness may be rapid. So if people mention that they were recreating and here they are 6 hours later, ill with multiple groups of symptoms, that's a clue that it might be cyanobacteria associated. And we know children may be more likely to become ill. They drink more water in recreational, such as Palm Island. In recreational situations, they may be in the water longer. They may swallow more water than adults, and they have more skin exposure. They have more surface area to body mass than adults. We desperately need tests for toxins and biological samples because diagnostic tests are needed to get in the hands of physicians and of veterinarians to confirm cyanobacteria-associated illness. Next slide. So I would like to acknowledge my collaborators at Wright State University, the Federal University of Rio de Janeiro, US EPA, the CDC, Greenwater Laboratories, and state partners. The next slide. Thank you very much.